We actually kind of divide modern day cataract surgery into sort of two camps. There's a thing we call traditional cataract surgery, and that's just like we would all sort of anticipate cataract surgery to be. And traditional cataract surgery, we're taking out the natural lens of the eye and replacing it with a manufactured lens that's sort of pre-made, and we have it readily available. And then what we do to figure out which lens you might need, we ask you, do you want to see distance? Do you want to see near? So understanding that from every patient is very important for all cataract surgeons, and what their primary target is. But with a pre-manufactured lens, these lenses get you close to what you need for glasses, but they don't ever get you quite all the way there. So any patient considering traditional cataract surgery, the benefit is the insurance generally will pay for your surgery. The downside is for patients that don't want to wear glasses, that's not really an option. You have to wear glasses after traditional cataract surgery to get the best clarity. So that's the first option. The second option is a concept called advanced refractive cataract surgery. Advanced refractive cataract surgery is really exciting because we're actually sort of combining some of the principles of LASIK surgery with cataract surgery. So for people that have been told in the past you're not a candidate for LASIK surgery, or you basically aren't able to get out of your glasses, now could be an excellent opportunity for your surgeon to help you figure out how to come up with a strategy to eliminate the need for glasses. And so within that sort of advanced refractive cataract concept, there's sort of different tiers of vision. So what we do is to understand what you're a candidate for and what you're not a candidate for is we have to do some enhanced testing of your eye. That really helps to reveal things like corneal astigmatism, or maybe retina problems or optic nerve issues or different things that may limit the vision. Based on those findings, we can figure out what each person may or may not be a candidate for. And kind of within the advanced refractive cataract surgery suite, there's sort of kind of three different options of choices. The first one is if we find astigmatism that's significant, we can actually work to resolve the astigmatism. And astigmatism really is just sort of a description of the shape of your eye. So if we have an eyeball that's round like a golf ball, if we shine the light through a round eye, a round golf ball, the light's going to bend equally in all points, and it's going to land in one focal point. So one source of light, creating one focal point, that's excellent optics. That's someone with no astigmatism. Someone that has a lot of astigmatism has more of an American football shape to their eyeball. So if you have a long axis and a steep axis and you shine a light through, you're going to end up with the light focusing in different locations in the back of the eye, and generally kind of two main focal points. So what that can create after a cataract surgery is a scenario where you see an image like the moon, but then you would see a shadow image of that moon slightly displaced or significantly displaced, and that creates kind of blurriness in your vision. So what's really great about advanced refractive cataract surgery, in my opinion, is we can actually bring all that light into one focal point, really maximize the clarity for you, and help to really achieve wonderful vision. Whether or not you mind reading glasses, that can still be a consideration, but for distance clarity, that really is just kind of the best way to achieve good vision for nighttime driving, all that kind of stuff. And so the next tier, beyond just solving astigmatism, would be to look at some of the technologies that are like trifocal lenses. And so they actually have these wonderful lens implants now available from a couple different manufacturers in the US. But what these are in general doing is creating multiple focal points of vision, or different sweet spots, if you will. And so we kind of divide vision into three buckets. There's the distance vision for driving, there's this kind of intermediate range for like computer use or seeing the dashboard of your car, and there's the near vision that we use for reading. And so when it comes to trifocal lens implants, they're actually splitting the light. 50% of the light goes for distance vision, 25% goes for the intermediate zone, and 25% comes for up close, allowing each person to sort of neuroadapt and learn how to see vision a little bit differently than what they're used to, but still wonderful vision. Each sweet spot gives them great focusing ability, so they can actually not have to wear glasses at all after cataract surgery. The last technology is the latest technology to kind of hit the US market, and it's sort of taking the cataract population by storm for those that are really interested in just really high quality vision and don't want some of the downsides that may come up with some of these other technologies. And that technology is called a light adjustable lens. Light adjustable lenses are interesting. They're standard lens, it's nothing new. It's not like a new technology that we've never placed in an eye before. It's based on a normal platform for a lens implant after a cataract surgery. But the key difference with the light adjustable lens is there's these polymers within the lens that are able to be manipulated or adjusted with UV light. And so what we do with this type of surgery is we're actually removing the cataract like we normally would with cataract surgery. We're replacing the cataract with this light adjustable technology or this lens, and then we let the eye fully heal. And then a few weeks go by, the eye heals up, everything's quiet, the eye is nicely recovered, and then we're able to take measurements on what you might need for glasses. And we're actually able to use a UV light source to imprint into the lens the actual prescription glasses that you would need. And so we can work with you over the series of a couple of visits to help understand, do you want to see distance? Do you want to see sheet music for piano playing? Do you want to read your phone? And just like looking through binoculars to see a duck across the lake, you can sort of dial that in. You can kind of get this depth of focus effect. We have that ability with these technologies to dial in your vision to your liking, whether you want to see more distance, more near. If you don't like what we did, then we can just reverse it and move it back out. And so this is really a wonderful dynamic way to allow an individual to sort of decide in real time, are they happy with their vision, or do they want something a little bit more clear in a different kind of zone where they find a sweet spot for their working distance. Once you're happy, then we lock the lens in, and then it's a permanent lens that's set in your eye for lifetime, and it never changes. And so that lens is very exciting. It is probably the downside, if you have to sort of pick a downside for the light adjustable technology, is just there's a little bit of a hassle factor on the back end because you have to come back for a couple of extra visits. So it takes the right patient. You have to be motivated to really want best vision. But for someone who's willing to go through a little extra work, you can really get wonderful results.